Hola,
Good morning. I'm just going to switch off the phone, and so that everybody does it at the same time. We all switch off our phones. Good afternoon to everybody. Thank you very much for coming along to this session. We do hope it'll be very useful for everyone. I think in general, the experts that we've managed to bring along to talk about what's going on in Europe and what's being done in other member states and find out what we're doing here within our national plan. We're going to have a lot of information exchange. I think this will be very fruitful. So please don't hesitate to ask any questions and make the most of the fact that all these people are here, and try to resolve any doubts. And also, we want to hear everyone's contributions that will be useful to be able to improve our work in the prudent use of antibiotics. So you all have the agenda. The first point will be the opening of the session by the Director of the Agency, María Jesús Lamas. She's just coming down now, and she was looking forward very much to welcome you all. Then, after her, we will have the different speakers, and when we finish the presentations, we have a change from the original program. The first presentation by CHAFEA is not going to happen, so we've had some logistic problems there, and they've not managed to come. But we do have everyone else, all the other speakers. And what we're going to do is that after each paper, we'll have some time for 1 or 2 questions. And then at the end of the day, we'll have a roundtable discussion. And you can ask all the questions you want and make your proposals, etc. So, as soon as María Jesús comes down and opens the session, we can go ahead. And please don't forget to switch off your phones. And if you don't want to switch them off, please just put them on silent. And please participate as much as possible with your proposals, with your contributions, etc., so that we can have as useful a day, as prosperous a day as possible. Okay, María Jesús, please go ahead. Hi to everybody. Good afternoon. Welcome to this session on the control of antibiotic use and surveillance of clinical pathogens in Europe, which we are holding on the agency here.
Abroad. I hope you have a happy stay with us. Para nosotros es un placer recibir.
For us, it's a great pleasure to have you here. We do hope that you feel it's your home too, because this project has no sense without you. This is all about collaboration together in many areas, particularly when we tackle a subject so important as antibiotics. So infections caused by resistant bacteria and treatment with antibiotics constitute one of the major threats to health that we face at this moment. And this is one of the major challenges for modern medicine. So the increase of resistance to antimicrobials is due to many factors, but the inappropriate and indiscriminate use of antibiotics is without doubt something that most contributes to this phenomenon that has a clinical, epidemiological, and microbiological impact. The main problem is a long list of, we have a lot of forums and centres that talk and work in a coordinated way to fight against this. The WHO, United Nations for Agriculture, the FAO, different agricultural organizations, the G20, and so this is also a priority for the European Union and has set out a strategy to face the problem the most effective way possible. In November 2011, resolution was published whereby a national action plan was to be drafted up to 2016 to stimulate different national plans for different countries, and the second international plan through in 2017 lays down a framework for a wider scope to reduce the propagation of resistance to antimicrobials and to increase the research and availability of new medicaments. And the national plan for antimicrobial resistance published by the Interterritorial Committee and the Intersectoral Committee of Agriculture to last 5 years up to 2018 has the objective to put the brakes as much as possible on this phenomenon. So it's been structured around, as you probably know, 6 main areas, working together for veterinary and human health with the perspective of one single health: surveillance, control, prevention, research, education and communication. So we're at the end of this first stage, and now it's time to identify the strengths and weaknesses that this first project has had and to lay the basis of the second plan. In general, we can say that the plan has been a good start-off point. We've worked quite hard, but as the results reflect, we've seen also a lot of collaboration multi-sectorally, and the objectives have to do with this spirit of collaboration and commitment covering all the sectors involved. And I think through this national strategy set up in 2014, we've seen this. We've had measurable results, so we're on the right road. And consumption in humans is down 4% and a bit, and in animal health we've seen a reduction in sale of antimicrobials of 14%. This data is a success, but it's even more important when we consider the previous trend, which was growing before 2012. So the plan has been very involved in all the projects we've done internationally. We're active in the joint projects across Europe. This is across the EU, and the project to implement this training program through Better Training for Safer Food. It's a project which we are hearing the name of right now, and the network for one single system and all the organizations that work together to fight against this phenomenon, like the G7, the G20, etc. So this meeting is the result of meeting between CHAFEA, the European Union area of human and animal health, and also to increase sensitization, because this is fundamental in all the strategy for fighting against this resistance. So we're starting a new stage. We're ready for a new plan, 2019 to 2021, through the Intersectoral Committee and the Committee on Agriculture at the end of this year. So this new plan is being drafted with the same spirit of collaboration and commitment on the back of the previous plans. So we start with a more solid base with bringing together all the work we've done over the last 5 years, but starts with new and more demanding challenges. As you know, we have new legislation for veterinary medicine and animal feed, with new regulations for the use of antimicrobials for animal feed to fight against specific infections and preserve the efficacy of these drugs. So we feel we are ready to meet the new challenges implied in. We need to work on new methods of diagnosis and identifying alternatives to the use of antibiotics, and to find measures to reduce the need for antibiotics. But particularly we'll need a new attitude in our use of antibiotics to prevent reaching this post-antibiotic era with everything this implies. So over these 2 days, we will try to find answers to these new challenges. As you know, this session is to really find a common focus so we can understand antibiotic resistance better and exchange our experience in this strategy for one soul health or one single health. So I hope you enjoy these sessions and that it will be very fruitful.
Muchas gracias, María Jesús.
Thank you very much, María Jesús. So let's see how we go. So we'll now go on to our main part of our session. As we said, we have first presentation was not going to be given as the speaker is unable to come. So we'll go straight on to our speaker, which we have here today.
La primera ponente.
Our first speaker is Pita Spruijt, more or less. She's a member of the coordination group of Work Package 5 within a joint action we are developing. We are collaborating with them. She's going to speak about One Health national strategies, the ones being coordinated within this Work Package 5 and the national action plans for AMR in Europe. The floor is yours.
Thanks for inviting me to speak here today, and I'm very happy to get the floor to tell you something about one specific work package of the European Joint Action on Antimicrobial Resistance and Healthcare-Associated Infections. My name is Pita Spruijt, very typical Dutch pronunciation, not very convenient if you travel a lot for work. And I work at the National Institute for Public Health and the Environment in the Netherlands. And as I said, I'm not gonna tell you a lot specifically about the Netherlands, but I will focus on the European Joint Action today. It's not working? Oh, okay. This works better? Okay. Should I just continue or? Yes. Yeah, okay. Today I will talk about the objectives of Work Package 5 of the Joint Action, and I will give you a very broad overview of the work that has already been done, because the Joint Action started in September 2017, so we are already 1 year working on several tasks, and then I will continue with showing you the next steps that are ahead of us. So to start with the background of this joint action, well, as I understood, most people in the audience are from the veterinary sector. And in the European Union, there's lots of regulation for the agricultural sector. If you look at the healthcare sector, then most policies are, or not most, policies are a national mandate within the EU. So although since years and years, countries have been talking about the way to tackle AMR. Most policies are organized on a national level, and just talking about the fact that we should do something on EU level is not necessarily giving the result that we are looking for, because we see that resistance levels are rising. And in 2016, the EU Council conclusions were adopted, and that expresses a need that there should be an EU platform to also discuss policy options for the human healthcare sector. And the joint action is an instrument to implement this. It's, as I understood from the previous speaker, there are several ways to look at this, but the joint action is one of the instruments that is currently in place. So the overall objective of the joint action is to coordinate policies for the control of AMR, and to implement policies across different EU member states, and to do this in alignment with initiatives of, for example, ECDC and WHO. And how are we trying to do that? Well, if I put it in one sentence, we try to do that by bringing together different networks. And I guess you could see this workshop as also one of the attempts to bring people together. In this case, focused on Spain, but within the joint action, we of course try to also bring together people from different countries, which is actually successful if I look at some of the speakers today. And then, the objective of the work package that I represent, which is work package 5, is to support member states on the implementation of the council conclusions. And maybe it's good to tell you that the first part of the council conclusions calls upon member states to have in place by mid-2017 a national action plan based on the One Health approach. And One Health approach is, in this case, collaboration between the veterinary sector and the human healthcare sector. And I think while we are working on this, the EU is adding the environmental sector to the One Health approach. But originally, we said, let's try to collaborate, to establish collaborations between the human healthcare sector and the veterinary sector. So, what did we do so far? We started with a mapping exercise to see if the countries that are participating in Work Package 5 actually have a national action plan, as was agreed upon in the Council conclusion. Then we continued with developing a self-assessment tool. And after developing it, all 13 countries participating in this work package also did a self-assessment. Might be possible that some of you in the audience actually participated in the Spanish self-assessment. I don't know. Could be. Could be. And as the Netherlands is the work package leader of this work, we analyzed all the self-assessments, and I will give you an overview of the results later on in this presentation. So ahead of us is actually a year, 2019, with country-to-country assessments. This means that countries are paired. So one country will host another country, and then in total there will be 26 visits, in 2019. And those visits are aimed at a very informal collegial sharing of experiences, sharing good practices, asking questions, and see how you can actually continue from the point where you are in 2019. Another task that we will focus on in the coming 2 years is strengthening supervision. The thought behind that is if you have great policies but no one is actually able to tell certain parties to also apply those policies correctly, that you have a good opportunity of nice paperwork but not a very good situation in practice. So looking at supervision seems to be a necessary addition. So this is a map of the EU. In dark green, you see all the countries that participate in Work Package 5. Spain is one of them. And in light green, you see 5 countries that are participating in the joint action, but they are not officially participating in Work Package 5. We did decide to invite all the countries participating in the joint action to participate in every single task that we develop. And in this case, you can see that 5 countries did map their situation. So one of the main questions was, does your member state actually have a national action plan? And luckily 12 countries said yes. There are also still countries that don't have a national action plan. And there are 3 countries that said, well, we have some kind of strategy or document, but we don't really call it a national action plan. And it's not a document that looks like the national action plan that WHO and the European Commission are looking for, but they do have some plans to address antibiotic resistance. So we're not there yet, but a lot has already been done at the same time. So to give you a bit of a historical view, more than 10 years ago, Germany and Sweden already had a national action plan. So they are coming from a long way with trying to tackle this issue. And then from 2013 onwards, several countries each year published their national action plan, with Czech Republic publishing their first national action plan this year. Second? I didn't do your mapping, so something went wrong there. Okay, so the first one was 11. Oh, something went wrong there. Well, that's maybe the risk of having a few people filling in such exercises. I don't know. Well, okay, so Czech Republic should be a bit to the left. But as you can see, not all countries have a flag here, because not all countries have a national action plan yet. Then, because I understood that today and tomorrow's workshop will focus on antibiotic use, I decided to show this slide that shows if countries have measurable goals for antibiotic use. So you should focus on the part that's in the red box. And what you see is that 4 countries out of the 18 participating in this task don't have measurable goals, but most countries do have it in place. And that was also a question of the European Union for member states to arrange that. And out of the things that are in the Council conclusion, actually the use of antibiotics seems to be the thing that is measured most. So that's the information I wanted to share about the mapping exercise, and then I continue with telling you something about the self-assessments which were performed this year. And unfortunately, Bulgaria wasn't able to submit a self-assessment, and the situation in Bulgaria is that the professionals really would like to join the joint action, but there's not enough political commitment at the moment to also make the financial resources available that are necessary to participate in the joint action. So yeah, it's quite unfortunate, I would say, that they are currently not participating, because they clearly have a situation where it would be good to get some support from their fellow European member states. Well, and then Norway, on the other hand, is not officially participating, but they decided to still join and send in a self-assessment. And Belgium, in this case, had overlap with the self-assessment and their ECDC country assessment, and they decided to send in their ECDC country assessment instead of performing 2 assessments at the same time, which is understandable, I would say. So what was asked from countries in these self-assessments? Well, primarily to name their priorities, to name their main measures taken, to name their main challenges, and also what they want to learn if they are actually going on a country-to-country visit from other countries, and what best practices you have to offer. So if you think about the veterinary sector in Spain, there might be something that you say, hey, we tried a new policy, it works very well, and it would be worthwhile to share this strategy with other European countries. So to, as you can imagine, information from 14 European countries on what they do in human healthcare and the veterinary sector results in a lot of information. So what we did is try to bring it down to 10 topics that are interesting to share with a broader audience, that are seen in multiple countries. And I will tell you the 10 topics now. So these are topics that were shared by multiple countries in their self-assessment. And the first 2 are a bit linked, because there's a group of European countries that says, you know, we have been working on AMR for quite a while, and now we face the problem of keeping the topic on the political agenda, because it's not new anymore. A lot has already been done, and how can we make sure that we can still address the issues that are there? And I guess, yes, Spain is one of the countries that said this, and the Netherlands as well. But on the other hand, there is a group of countries that is still struggling to get it on the political agenda. So they don't necessarily have a national action plan in place, and they don't necessarily have support from their political parties, and they really want to know, how do we get it on the political agenda? In both cases, it's about convincing the right people that we should do something, but it's a different stage, I would say. So the third topic is, how do you set priorities if you look at different domains and different sectors are involved who might not necessarily see the added value of work done in other domains? So how do you set priorities or choose a focus if there's so much different things that you could do? Which is related to the next topic 4. How does the One Health approach actually work in practice? Do you really have to come together, or do you have to agree at one point that the veterinary sector will do one thing and the human healthcare sector will do something else, and then there's not necessarily a lot of collaboration in between? So the question, how does the One Health approach work in practice, was raised by many, and it will also most likely be raised during the country-to-country visits, because I think currently European countries have different ways of working, and they all call it the One Health approach. Then there is a lot of EU surveillance data collected by ECDC, and the EU data gives you the opportunity to put your national data into perspective. At the same time, it's not a way to necessarily convince policymakers or politicians what they should do. So it's difficult to make an interpretation of the EU data for national purposes. And then this one is very true for Spain, as I was told. How do you deal with responsibilities between a national and a regional level? Who should do what? So this is something that I absolutely don't recognize from my own country, which is much smaller and organized on one level. But as I understood, there are multiple countries in the EU who have this difficulty to deal with the national versus the regional level. Then point 7 is that countries have very different experiences with working with measurable goals. So yeah, that was just reported. Let me not say too many things about that. Point 8 is that there is very good news, I would say, that several countries have shown that if you manage to take policy measures, that they can contribute to reducing resistance levels. At the same time, ECDC keeps telling us that overall resistance levels are still rising. So yes, there are good examples that policy measures can work to reduce resistance levels, but maybe we are not yet doing enough, because overall resistance levels are still rising. And then the final topic that I will present is one that puts the veterinary domain in the spotlight. I figured that would fit the purpose of these days. There you see that there are large differences between countries, and that countries say that best practices from other countries are very useful. But that, for example, the collection of sales data and antibiotic use data is difficult, especially if you want to go down to animal species levels. And then the political pressure helps to set up an infrastructure for surveillance, for cooperation between stakeholders and domains. And we see again two groups of countries within the EU. Like there's a group where this political pressure is present and successful, but there's also a group of countries that would like to have more political commitment, but they're still struggling to get it. Well, after seeing these 10 topics and seeing the mapping exercise where most countries actually have a national action plan, but not all, we will now continue to the country-to-country assessments. And the main aim is to evaluate each other's situation. So if you have a national action plan, what's written down in it, and how can you actually implement the plans you made? And that's up for next month, actually, if it comes down to Spain. So the Netherlands, which won't be me in that case, but a delegation from the Netherlands will visit Spain by the end of November for one of the first country visits. Already 2 took place this month. And in 2019, all the other visits will take place, and that will bring Spain to Sweden. So in case you have any question or any good example that you want to share during either one of those 2 visits, I think you can contact Cristina about that, right? Well, all the other paired countries are listed here. And well, I'm actually really looking forward, because so far we mainly did a lot of paperwork, and now countries get the opportunity to really have a look in someone else's, say, hospitals or slaughterhouses or whatever they decide upon to see. And visits will take 3 to 4 days, I guess. So there's also really some time to discuss what's going on and if we can help each other. And then a picture. This one was made in Poland last month, where representatives of the 13 EU countries were present to actually talk about the self-assessments. So that was my talk for today.
Thank you so much, Piti, for the very nice presentation. ¿Alguna pregunta para Piti?
Is there any question for Pita? We have questions, time for 1-2 questions. When a condition to be here is that you need to ask questions. No? Well, it's okay because it's the first one. But it's the only one. Prepare some questions for the following presentations, please. So now we have our second presentation, which is about the Belgian experience. We have Fabiana del Pozzo. She's the coordinator of AMCRA, which is the organization, the Belgian organization that's coordinating all the actions, the plan regarding antibiotic resistance. Fabiana is a vet herself. She's worked as a researcher. She's also worked with different animals. And she's the coordinator of AMCRA. And she's active with many other authorities in identifying the good use of antibiotics in Belgium. And she's an action expert in country visits organized by the EC. She's here to speak about what they've done, about their work, and to give us an overview of her experience, which is going to be very experienced. Fabiana, the floor is yours.
Hello, everybody. Hopefully I'm going to be very clear. And I'm going, like you just said, to tell you about our experience in Belgium, only from a veterinary perspective. So I'm not going to talk about the human side. So it's not very One Health, but that's my work. We are only competent for the veterinary side. So okay. Here I made for you a kind of timeline to show you what has been done in Belgium in terms of antimicrobial resistance, tackling antimicrobial resistance. And we see that already from 1999, there was the idea to start to talk about AMR in the veterinary medicine, and not only in the human medicine. But I have to say that it was indeed more a kind of goodwill. There was a very good intention to do this, but we didn't really succeed at that time to take really actions. So there has been some activities that have been done. For example, 2007, 2009, there are some reports of AMR in the pathogens in the two regions of Belgium, Flemish and Walloon region. Then we started from 2010 to collect data of use, or better, sales data in Belgium in the veterinary medicine. And also in 2011 to monitor AMR, using the indicator bacteria, Escherichia coli, in the major livestock species. And then in 2012, there was the creation of AMCRA, and I will show you why we decided to create AMCRA and what it is AMCRA actually. Yeah. So here you see an overview of the sales data in Belgium in the veterinary sector. The blue bar are the antimicrobial, the pharmaceuticals, and the red ones are the medicated feed. What you see is that from 2007, 2008, 9, 10, 11, there was quite a decrease in use, but in fact, yeah, there was a kind of, how can I say, it was like if we were reaching a kind of steady state. On top of that, we also saw that our neighbor country, the Netherlands, who was using more antibiotics in the veterinary medicines in 2007, actually succeeded in reducing quite a lot and quite fast their use of antimicrobials in the veterinary medicine in the same years, and this was facing reality, facing the fact that we were not so efficient in doing that. And also there was the first ESVAC report where next to countries where there was quite a high consumption of antimicrobials, there were also countries that were succeeding in using much less antimicrobials. So there were experiences already in 2011 telling that it was possible to use less antimicrobials. So we decided to do something, and we decided to create AMCRA. So what is actually AMCRA? AMCRA is a non-profit organization. So AMCRA means antimicrobial consumption and resistance in animals. Our mission is to tackle AMR, to preserve human and animal health, to promote rational use of antimicrobials. And what do we do exactly? Every day we collect data of use, or we analyze the data of AMR. We communicate about the data. We try to increase awareness between the public, mostly farmers, veterinarians, but also sector organizations. And we provide recommendations, which are in fact also not only for sector organizations, but also for the authorities, because authorities are decided in that time, in 2012, to give some of the how can I say, not responsibilities, but some of the competencies in terms of tackling AMR, to give them to us. And these competencies are indeed the one that I'm just telling you, communication, giving advices. So based on what we see, data, use of AMR, based on the communication that we have also with our partners, we take decisions and we make recommendations. So it's important to know that our recommendations are not just scientifically based. So of course there is, we take in consideration evidences from publications and so, but we also take in consideration what our partners are committed to do. If they say that thing we will never do, we don't want, we are not yet ready to do that, to take that action, it doesn't help that you tell them 300 times that they should, that they have to, because they are not ready to do that. So we prefer to take in our recommendations the experiences and their point of view of the stakeholders, and to provide recommendations or advices that will be then effectively put into action, that they will be effectively used. This is our organization. So we have a steering committee, and in the steering committee you have the authorities. So which means that actually the authorities are deciding yearly with us every year what do we do, what we should do, what are the priorities for us. Then we have a board of directions, and here we have our partners, agricultural organizations, veterinary organizations, pharmaceutical industry, the industry of the medicated feed, and the university. And then in making our advices, we also work with working groups, and we have yearly a meeting with an advisory board. And these are the people working for AMCRA. So we have 2 people working in for awareness raising, communication, advising, and so. And you have 3 persons working for the scientific analysis. So they perform some analysis, and we can take in consideration their data to develop our recommendations. So since the beginning, we started to do some work. We had in the beginning quite many advices to write down, because you had to start really from scratches. So we provided an advice where we said, okay, it's really very urgent that we start to collect data at the farm level. This is an advice of 2012, and in 2014 we will have the first at farm level collection system for pig farmers. In 2013 there was an advice about auto-regulations, so what actually each sector, production sector, can do by itself with its own activities that he can do by himself, without that the authorities are coming to create new legislations. Then we developed in 2012-13, we started to work at guidelines for veterinarians. These are guidelines which are specific for the most important animal species. They are for companion animal or for food-producing animals. They are nowadays in an online platform, so they are electronic available. I will show you some screenshot of the vademecum. In the vademecum, we work with color codes, and the color codes are in function of the importance of the molecule. in the human medicine and in the veterinary medicine. So we worked considering the recommendations of the WHO and of the OIE. For example, the yellow molecules, but all of them, all antibiotics, considering AMCRA recommendations, should not be used in prophylaxis, none of them. There is the possibility for the farmer to have a stock at the farm, and we say, yes, this stock can be done as well for yellow and for orange antimicrobials, but not for the red ones. Pathogen identification at the lab, so if you do a bacteriological analysis, well, by preference for the yellow molecules, it's a condition for the orange and the red, and the antibiotic sensitivity test is by preference for the yellow and the orange, and it's a condition for the red. So these were recommendations from AMCRA, and they stayed like this. They were just recommendations until 2016. Since 2016, the authorities, they decided to take this group of molecules, the red ones, what we call the red ones, and these are the most critical ones, fluoroquinolones and cephalosporin of 3rd and 4th generation. And these molecules were put into a new legislation, and so nowadays in Belgium, if you want to treat food-producing animals with these molecules, you really have to respect these conditions. All the others are not by law, so these are just recommendations nowadays. This is how it looks like. If you go to the website of the formularium of AMCRA, you will find the 6 animal species, and if you click on one of them, you will have a list of conditions, pathological conditions, and by clicking on each of them, you will get a page with some indications useful to know some general information about the pathology, and then recommendations when it's possible about vaccination, for example, or hygiene, or other therapeutical recommendations other than antibiotics. And then you have the first, the second, and a third choice with the color codes. And by clicking on each active substance, you can also get the list of products that are actually commercialized with this active substance in Belgium. In 2014, AMCRA developed what we called the Vision 2020, which is in fact the action plan for Belgium for the veterinary medicine. And what do we have in this Belgian action plan? We have 3 reduction targets that you see here. So 50% total reduction of antibiotics by 2020, 75% reduction of the red molecules, so fluoroquinolones and cephalosporin of 3rd and 4th generation by 2020, and 50% reduction of medicated feed with antibiotics by 2017. And next to that, some operational targets. These are in fact kind of actions that you should do in order to achieve your reduction targets. And this is just, again, this is work from AMCRA. You don't see until now any kind of influence of any kind of, authorities were not involved into that. They were just supervising. So based on the AMCRA recommendation in 2014, we started with the collection of data in the pig sector in Belgium within this system of data collection called AB Register. So here it's an overview of a flyer that we are still using nowadays, where we explain to the farmers and to the vets what is exactly the information that they receive in a report. When they get a report, when they receive also some information of use, quantification, and some information of what kind of antibiotics are you using. These information are quantification are within this BD100, so it's a kind of parameter reporting the number of days of treatment on 100 days. So it's a kind of in percentage. So you get the percentage of treatment of your animals within your farm in a fixed period of time. And you get it also for the complete farm, or you can get it for per animal category. So piglets or sows, for example. So you have the different categories. And because you have the data from the complete sector, so the pig sector in this case, you can also take this data, the BD100, and you can benchmark your farmers in farmers which are in the green zone, so they are using a safe amount of antibiotics in their farm. In the yellow zone, and it's a kind of alert zone. It's not too high, but it's already higher than the green. And then you have the farmers in the red zone. These are the ones that are using really far too much. And here they should try together with their vets to really implement actions in order to reduce their use. Again, an overview really of this. This is really a report that we send. So you have the monthly use in the farm. So this BD100 per month. You see some fluctuations, of course. Then you have the benchmarking here. So the BD100 of this farm, it was in the yellow zone. So he is in the yellow zone. And then the evolution in time. So two periods of time, you see here, for example, that he is not improving, but on the contrary, his BD100 is increasing in the time. So there again, you should see with his vet why is it that, and try to do better. Then you have also some qualitative information referring to the AMCRA color codes. How many, which kind of antibiotics then are they used? Yellow, orange, or red? And this is again this is the farm compared to the rest of the farms in Belgium, pig farms. And he receives also the information on exactly the active substances that are used. For example, here, tetracyclines, penicillins, aminoglycosides, and so on. He receives also some more info considering the use of zinc oxide and the colistin, because these are information that are especially nowadays quite important if you know that you should by 2022, if I'm not wrong, completely not use anymore zinc oxide. And colistin, of course, it's a very important, critical important antibiotic. So there also, there is a specific need to benchmark the farmers for these two molecules. And these are the evolutions that we see in the pig farmers, in the pig sector since 2014, when we started with the data collection. In 2017, we have a total reduction in the pig sector of about 20%. And you see also per category, animal category, where the reduction was the most important, for example, or where probably is more difficult to reduce in your antibiotic use. So I wanted to give you also one more information about this project, Acting, which provided quite, again, a European project, and it was very useful in order to bring together people from different European countries. The main objective of this project was to make a kind of inventory of the systems using existing in Europe, at the moment, in terms of farm level AMU monitoring systems. So, and you have at this website, you have the possibility to click on the different countries where now the information is available, and you will get the systems that are active at the moment in terms of data collection at farm level. So this is for Belgium, for example. So you have the AB register that I talked about for pigs. Actually, AB register is also working now for chick, turkey, and recently for milking cows, dairy cows. Then you have Sanitarios, which is the national data collection system put in place by the authorities, and this is for calf, chick, and pig. You have also in the south of the country Bigame for milk, dairy cows, and beef, and a specific system for veal calves. So it's quite complicated, but the point is that all these data are coming to AMCRA. We do the analysis, and we provide to each of them the data that they are asking, of course, and the data that they consider the most pertinent, the most relevant for the farmers and the vets. These are the data from the Sanitarios, so the national data collection system from the authorities. And what we see here, that we have not only pigs, but also indeed veal calves and poultry. So we have in this moment the first data for Belgium, also for other two sectors, different than pigs. But what we still see is that pig represents the biggest sector in terms of use, followed by the veal calves and the poultry. So there was a reason why AB register was starting with pigs already in 2014. We knew, in fact, that pig was the most important sector to tackle. These are in terms of class of antimicrobials. We see that the penicillins are the most used, followed by tetracyclines, zinc oxide, trimethoprim sulfa, macrolides, and you have very low quantities of fluoroquinolones and cephalosporin of third and fourth, probably also because of the legislation that I told to you. If we go to look specifically for fluoroquinolones, we have a special, I like to show this for poultry, for the poultry sector. In fact, we see that especially fluoroquinolones are used in the poultry sector in the broilers. So this is a very important message to give to veterinarians and to farmers, because fluoroquinolones are critical, important, and they should not use so much of these molecules. In 2016, we come closer and closer to present. We have an important year because the authorities and the stakeholders decided finally to sign this AMCRA Vision 2020. So the action plan that was defined initially by AMCRA was also accepted also by the authorities and the stakeholders. So in this moment, we really have everybody who is deciding, okay, we really have to go for it all together. And in this moment, the signature was not only from the Minister of Agriculture, but it was also the Minister of Public Health. So that was quite important sign, political commitment, in fact. Like I told you, in 2016, we have this royal decree about the use of critical molecules. A couple of months later, we also have another royal decree. It's about the compulsory registration in this Sanitarios system that I showed you. And these are some examples of actions undertaken by the stakeholders in the antibiotic covenant. And as you see, you have the pharmaceutical industry, private quality schemes, animal health associations, medicated feed, agricultural organizations, veterinarian organizations, and I didn't mention, I didn't place, I want to say, authorities and AMCRA, but there are also their commitments. So we are working a lot in terms of awareness raising with all possible kind of actions and things that you can do, posters for foodborne, how to say, animal, food producing animals, sorry, and companion animals. We also have an AMCRA YouTube channel with different spots and videos, reportage, which are done by the farmers and the vets in order to give examples that are good examples where they feel that they can share their experiences with others. Our new website, which is unfortunately nowadays still only in French and in Netherlands, but we will certainly work on an English version where you can find, in fact, we try to make it informative so that you can go there and you can find information about AMR for a broad public, so not just some very already not just the scientific public, but it has to be accessible to broad people, the general public as well. Awareness raising, you find all our tools there. The link to the vademecum for the veterinarians or the students of veterinary medicine. You find also the methodology about quantification of the AMU at the farm level, so what our scientists are using and doing, and links to national and international organizations and reports. And these are our last results. In 2017, so last year, we reduced by 66% the total use of medicated feed compared to 2011. So we definitely achieved our goal. In terms of use of critical important antimicrobials, in 2017, we reduced by 84% the use of these molecules compared to 2011. Here again, we achieved our goal, certainly thanks to the new legislation, because if you see here, before the legislation 2015, there was an increase in use in the red molecules. And it's at that time that the authorities decided that they had to do something. They had to intervene. Just auto-regulation was not sufficient. And this is the total consumption. We are at about 26% reduction compared to 2011. So we still have, in fact, halfway to go. And we only have 3 years left. Well, it's very challenging, but we see that we have quite new things that are coming, like the benchmarking at the farm levels. Until now, only pig farms were receiving these reports that I showed you. Nowadays, the first reports for veal calves and poultry are also sent, so they will also be more involved, and of course we will continue with awareness raising, and we hope that it will go better and better. And these are data from AMR, so resistance data. I only took data concerning the Escherichia coli, so the indicator bacteria in food-producing animals, and only for resistance data for the critical molecules. So, for example, for fluoroquinolones, we see that we have a reduction in resistance, but still we have one sector, and this is the broiler sector, where you have a quite high level of resistance. And I like to associate this data to the data that I showed you just before. The use of fluoroquinolone in poultry was the highest. So here we see a nice correlation, unfortunately, with the AMR. And then resistance to third generation cephalosporin, which is, the trend is still okay, but we see that there are some years where, for example, last year, resistance to this molecule was quite increased for all the 4 sectors. I don't really have an explanation. The only message is that we really have to continue to monitor, and you can have some years where you have some up and downs. Unfortunately, AMR, it's complicated. It's a very tricky problem, complex with many factors that are intervening, and it's not just the use that you do in the farms. Multi-drug resistance in the same sectors per year. So the very dark green is indeed the multi-drug resistance, or resistance to more than 3 antimicrobials. And we see that we have, in fact, very few multi-drug resistance in beef cattle, followed by fattening pigs and veal calves, and then again the broilers. So we really have the broilers to keep a good eye on them. Perspectives concerning the One Health approach. Like I said, we have a national action plan for in the veterinary medicine. We have it in the human medicine, but we don't have yet a One Health action plan. So we are working on that. And it's now the moment to do it, because both plans are ending, one in 19 and one in 20. So it's now the moment to start to think about what to do together, including also the environment. Voilà. Thank you for your attention.
Micrófono, por favor. Question?
Ya eso se acabó el comodín de la primera.
Any questions? Okay, questions in Spanish, okay? I'm a vet that works with calves, and it's very interesting that what you're doing with the farmers. What is the tool of success? The successful tool. I'm working with calves, veal calves. What is the most successful tool that you've used for awareness raising amongst the farmers? I know it's very difficult. As a vet, I know this, to convince them about this, about not using antibiotics. And what communication strategy, what was the most successful that you used?
The agricultural organizations with us. Like I said, the idea is really that we are not doing things alone, so it's not just me that I'm going to talk to them. Of course I do that, but I am invited by the sector itself. So they are organized, of course, in kind of small circles, and it's within their organization that the awareness is done, and then they know that they have to come to us. It's not that they have to, but that they can come to us, and that we will go and we will speak to them. But the sector, the organizations themselves, they committed themselves to promote the subject within their people, among their people. So if they don't do that, if you don't have articles that are published in their own magazines, if you do not have on the website constantly, their websites constantly, the topic coming, you will not get them with you. So it's really coming from these people. And of course, how do you get these organizations with you? Well, you have really to sit at the table and to show that it's really necessary, and that you will have also, of course, you have to try also to use some arguments that are relevant for them, because if you just talk about public health, I'm not sure that they will be listening so much to you. But if you start to talk about the fact that AMR is also affecting the health of their own animals, of their own families, because there are some pathogens or bacterial infections resistance, they can really, the first persons that are at risk due to the direct contact are these people. So you can also use maybe some kind of strong argument, but you have to find the right arguments why not the economical point? There will be a moment that they will be touched by this, because the public awareness, people, the consumer, is more and more aware of the problem, and they don't want that animals are treated with antibiotics. We all know that they have to be treated sometimes, but we also know that many times it's not so necessary. Yeah.
Related with the different categories of antimicrobials, you present in one slide that is necessary in some cases the bacteriological diagnosis, and in some other the antimicrobial susceptibility test.
Yes.
How do you solve these points at field level?
How do I check if they really do that, you want to say? Well, when the new let's start from the end. So let's start from the moment when there was the new legislation. At that time, if there is a new legislation and you go to make controls on the farms, or you control the veterinarians, you can ask to show the evidences that they had the test and the results of the test from the lab. So at that time, I should say, it's a matter of control and putting the right pressure after implementing a new legislation. But when we didn't have this instrument, so just AMCRA recommendations, well, it was not done. It's very simple. And there again, you have to have the vets with you in that case to promote the right, the good practice, because these are just good practice. Everybody knows that when you are choosing an antibiotic, you should do it thinking, okay, based on evidences from the lab. But from the Belgium experience, I can say that a good point from the new legislation was that many vets had to go back, I don't say to school, but they had to go back again and learn again what it is exactly making a good sampling, sending the good sample to the lab, asking for the good results, like the good tests, and also reading these tests and choosing for the good antibiotics. There was evidence that these good practice were a bit lost in the there are some practices that are becoming frequent, and that you know that you should do something else, but still you take the easiest way, and
This is not the easy point at field level, because in general the practitioner, the veterinarian need to do the diagnosis, and immediately after the diagnostic implement the therapeutic with different antimicrobials without laboratory, without different analysis that is necessary to exactly treat and use the good molecule for this singular case. And probably this is the not easy to do at field level this this way of do, and I believe that it's necessary to implement some other kind of epidemiological diagnostic and so on. And I believe that in Spain, for example, this is one of the most important points to implement in the future, the use of this kind of information that arrive to the veterinarian, and this information probably will be used for the veterinarian, not for the exact case, but this epidemiological information will orient the correct therapeutic use of different antimicrobials.
So indeed, at the end of the year, there is a report of all the data coming from the labs, and this report is published. So there is it's public available, the results every year that we obtain from the labs based on AMR, on pathogens, so on isolated from the fields, and veterinarians can access this data, and they, of course, this is also should in fact help them to, yes, of course.
Okay, you can go first.
Thank you. En español, si puede ser.
I agree with my colleague. It's very important. Gathering data is going to be very important in order to prescribe a treatment. You need to choose the proper antibiotic besides analytics. But I'd like to ask you, I didn't know if I understood it right, but the important phase when you reduce the use of antibiotics is when you published the legislation. Yes?
For the red antibiotics, yes. For the critical antibiotics, absolutely yes. But for the total use, where we only reached this 26% reduction, only, which is, it's okay. Yeah. So we go to the end of the presentation. Voila. So yes, so these are the red ones, okay? And indeed, this is really due to the legislation, no doubt. You had to do something. You couldn't just hope for the goodwill of people. It was not working. Here you have, okay, look, you have 16, 17. The orange ones is the reduction. In fact, you don't have such a huge reduction in the total consumption, even with the legislation. Why not? Because these are milligram active substances on the biomass. And the problem of the red antimicrobials, these very critical antimicrobials, is that they are very light. They don't have any weight, not so much weight on the total. Tetracyclines or penicillins are huge molecules, and their weight is much more than, so you don't translate the reduction of the red molecules so much on the total reduction. So this is why here what we will have to have here is the fact really of the benchmarking. And I didn't talk into depth about it, but next to the benchmarking, so they not just receive a report, but this quality scheme that they signed the covenant. So this quality scheme is like they are in fact. Do you understand quality scheme? So they say, okay, if you want to stay into my quality scheme, you should, and you are in the red zone. You should, by the next period, you have to have a reduction in your antibiotic use. Otherwise, there will be kind of. Otherwise, you have to, for example, you have to let come an external, another third part, like a coaching. And you will have to pay this person to let you give advices. So in a first time, they say, just talk with your vet, but if you see that next time you're still so high, you will have to pay for a third person coming to the farm and coaching you because you are not succeeding to reduce. And we really rely on these actions at the level of the red farmers, but there are also actions, of course, in the orange farmers. So the farmers in between there, they also have to do something because otherwise, yeah.
Okay, muchas gracias, Fabián, por.
Thank you very much, Fabiana. At the end of today's session, we'll have the opportunity to ask more questions, to have more dialogue regarding the presentations. Now let's continue with our session. Our next speaker is Ines Moreno. She works for the Ministry of Agriculture and she's going to present the new Spanish system for the collection of data of antimicrobial prescription. It's a royal decree recently published. It's going to be implemented in January 2019. Ines will be presenting the system, what we want to do with it, with the data, etc. So Ines, the floor is yours. Good morning. I would like to thank the organizers for inviting us to be here to speak about our system. Right now we're promoting it. We want to give information because January is coming and this is a mandatory communication. Any plan to tackle resistance has to deal with veterinary prescription. In order to be familiar with it, which is necessary in order to tackle it, either we look at Facebook accounts of prescribing vets, which is going to be burdensome, or we start to gather reliable and comparable data to tell us what's happening in the field. This is very important for us being here today to encourage all of you who be subject to this obligation. You need to start carrying out tests, and I'll explain this in detail later on. But I would like to encourage you to help us to improve the system, because you know that when you launch a database, you always encounter problems at the beginning, things that are not working properly. So I want to find them, to identify them right now before January, and this will make things easier for us once it's in effect. Where does this come from? It comes from a regulation which hasn't been published yet. It's a national regulation, which is the new regulation on veterinary drugs. Article 57 establishes the future obligations for member states. In 5 years, for food-producing animals, we have to collect data from antibiotic prescription. And for the rest of species, not just companion animals, but also farming species, which are not food-producing. We have 8 years for those ones. In PresVet, we haven't tackled this second group of species. We will do this at a later stage once we have the first one up and running. And there are no obligations for companion animal owners. This is for professionals only. What's the purpose of this data collection? We need to combine 3 sets of data: consumption, prescription, and EU collection. And all this will be included in an annual report. This is to be developed. We've developed a basis, but this will come later on. We're ahead of this regulation, which hasn't been published yet, and Royal Decree 199/2018 establishes this as something compulsory. It will be in effect on the 1st of January 2019. As I've said, this first phase will deal only with food-producing animals, and it collects data from premixes, medicated premixes, and other formula. They will be collected into different dates because they're specific. Each one of them is specific. As I've said, companion animals are not included, not yet, but given that there's a period of 8 years established by the regulation, they will be included in a second phase. Why are we collecting this data? Well, you know that having consistent and comparable data is a basis for everything, because the quality of decisions will depend on the quality of data. So, our first goal is knowing the number and the type of antibiotics prescribed in farms. We can also associate them to a certain vet. And, above all, we'll have data for each species, food-producing species. What's the goal of this data? Well, having proper measurements in place. This is not just about controlling. As my Belgian colleague has said before, we need to identify good practices, benchmarking. And these good practices, both at farm and vet level, will help us to see what's happening in farms or vets with higher consumption compared to average consumption. Right now, Royal Decree was published last April. The obligation will be in effect on the 1st of January, and right now we're undergoing a trial period. That's why I was encouraging to try, because anything we include now is not binding, is not legally binding. So you don't need to pay attention to what you're prescribing. You can prescribe anything you want, right or wrong, because it is just trial. We're testing this system, so you can test it. Include true data, false data, because we're testing the capabilities of our system to gather data, and the data collected now will not be used for anything. We have different profiles, 3, and each profile has a series of permits of authorizations depending on the use in the system. We have a vet profile. They can check data recorded by the vet himself or herself, both in the system or through a platform. They can check what the system has recorded about their prescriptions, and also they can record data. But there's a specific thing here that I will explain in the second column about data recording. This is done right in the central system or the autonomous region system. In regions that have established their own regional system for data recording, and I have established that it has to be done in a certain way, the system will not allow data recording. So vets will only be able to record data directly in the system in the 12 autonomous regions which do not have their own system. It's done directly in the national system, either by the vet or through a platform that records data in PresVet. Then we have autonomous region profile. They can check all the prescription in that region and the recording. The last profile is a central administrator or central manager that can access all the data in Spain to analyze this data, and also they have some management privileges as corresponding to its role of central administrator. How do we upload the data? Well, I've said some things already, but PresVet has 3 systems to upload data. But there are many others, because here I'm just referring to direct uploading into the system, but I've already said that in some regions they will do it into the regional system. So the first way to record data. This is recommended for a limited prescription number, because otherwise it will be too long for a normal person. And this is direct recording through a form. I will explain this later, but this is just an entry by a vet accessing the system, logging in with their electronic certificate, and then probably ID and password, and it records prescription being made. And for that, the system has a series of validation proceedings that I'll explain later on. Another system, when we have a high number of prescriptions, we have another option for direct recording, which is uploading an Access file. It's not any Access file, it has a specific format which is already available in our application. It's a trial mode, and I'll explain this later on too. And lastly, we have web service. We can use a platform and e-prescription platform, or big farming groups. They have their own platform and they use their own system to gather this data, and that system uploads the information into PresVet. In autonomous regions, they also have the possibility to upload the files. There are 2 ways, either with an Access file or through a web service. In the case of autonomous regions that have a regional system, and they regularly upload it into PresVet. And as I've said, vets in autonomous regions in which this is not regulated, they can use the 3 systems. Once the data have been uploaded, they have to be validated. First validation, and I want to be very clear, the first validation is the location of the farm. When I said that the vets in one region need to prescribe based on whether there's a regional system or not, we don't care where the vet is located. The important thing is where he or she is working. And that will establish the obligation to upload through the national or regional system. It's where the farm to which he's prescribing is located. So this first validation would be farm validation. If you try to upload data from Andalusia, and which has its own system, the system will reject this data. If it's Castilla-La Mancha, which doesn't have its own regulation, the system will validate data that are wrong for some reason. And therefore, if the region accepts a direct, if the region does not have a specific system, the data will be accepted and then they will be validated. Once the data have been accepted, the system sends a message to the person informing whether the data were accepted or were rejected due to the following mistakes, for example. What about these validations? Well, PressVet communicates through web service with other databases. We have Rega, which is one database, and this code we are including the prescription. It's going to explain where it's located, because it will be rejected if they're not in the proper place. And then species validation. Why do we want this? The system will send a message if we are prescribing for an ordinary species or for a species which is not recognized in the system. For example, we're prescribing for pigs in a poultry farm and they're not authorized for pigs. We will be given a first notification that the data are not consistent. But so far the system allows the recording. They warn us, but they allow it. We know that there could be some synchronization problem in the data, so that's why we're allowing this right now. And then another web service from the agency. What do we have here? Data from all the veterinary drugs that are authorized. The type of packaging, presentation. This data are included on the recording. They're not compulsory. Once the system recognizes the drug we're using and it recognizes it in the agency's website, the system validates them and it includes a series of data which are not necessary to record. They're not recorded in ordinary prescription because the technical sheet of each drug already includes the use we expect. However, this field that comes from the agency can be modified in certain cases, for example, an exceptional prescription. For example, if we want to change any information in the technical sheet, but it has to be an extraordinary prescription. These are the steps a vet goes through when accessing. First of all, accessing the system. You can already access PressVet. You can register there, and I encourage you to inform us, to let us know any incident you may have with the system, so that we can identify incompatibilities that you always see once the system is up and running. And this access for veterinarians, we've modified the professional association number. You will see this in PressVet, but we've tried to unify this number, which is different nationwide, and we include the code for the province and then the professional number. However, a vet, the tax ID number will limit the access of a vet. We're going to use the, correct myself, I mean the national identity document. That's what identifies the vet. So documents which are mandatory for vets, this will be direct recording through the application form. First of all, this vet has to be identified using the professional association number and the national ID card number. Second, Riga code of the farm to which we're prescribing, the type of prescription, ordinary or extraordinary, and then the drug we're prescribing. As I've said, you don't need to record all of this. Don't be scared. There are many fields because most of them are uploaded by the system itself from other databases. So another recording system. This is an example of the Excel spreadsheet. The first field is Riga code, then data from the prescribing veterinarian, and then the national code. This identifies what we're prescribing. As you know, validation through an Excel file causes a lot of errors if you provide text fields, whether the accents, etc. That's why this one associates a code, a number code, to a species. Why? Because this way there are fewer errors. There's a sort of data dictionary where you see all the codes linked to that species. Another functionality, it's the search engine for recorded data. You can access it at 3 levels. If you, as a private vet, access with your profile, you can access all the data of your prescriptions in the system, whether they were made directly in the system or they're uploaded from a regional system or prescription database, or prescription platform. This is very useful for vets working in regions which do not have their own system, and also for vets working in different regions. If I want to check what the system has in different ways, in the case of Aragon and Catalonia, because in Aragon it will be direct, and in Catalonia they have their own system. In this case, you can see what the system has from both regions. So it's not limited to the ones carrying out direct recording. It's also useful for regions because they can check based on different fields and they can gather data from everything that has been recorded in that region. This data will be taken from the system in order to draft a report which has not been regulated yet. I would like to finish by saying that PressVet is being implemented right now. That's quite a challenge. Starting on the 1st of January and receiving all the prescriptions and data. But there are things to be developed, improved. We've planned them for the following steps. Once we're correctly collecting data, we're going to improve the data quality because it will provide us with a more accurate view of what's happening in Spain, and also we want to improve functionalities of our system. The purpose of this system is to become a system where you communicate, you report, but also a tool, a learning tool. And you, as a vet, you can see how you're doing compared to the rest of Spain, or as a farm, how you're doing compared to other farms with similar production system. There are lots of developments to be done. And the first problem we are encountering is in extraordinary prescriptions. Perhaps the antimicrobial we're prescribing has not been registered in the agency as a veterinary drug. It may have been prescribed in a different member state and it's applied in Spain. Then we have other type of formulations, and we're working to solve this with our system, which is the case of magistral formula, and we're working in our system to be able to include this, which will make data collection a bit more complicated. I've also mentioned the improvement of the different functionalities we have in our database to carry out a quick analysis of what's happening, to identify an abnormal increase of prescription in one area. We want to include automatized analysis at 3 levels: vet, region, and ministry. And also, for looking forward, we would like to collect more data. For example, veterinary diagnosis. So we need to study how to include these fields in the system once everything is working properly. And this was my presentation. I don't know whether you have any doubt.
Muchas gracias, Ines, por la presentación.
Thank you very much, Ines, for your presentation, for explaining what we will be doing starting on the 1st of January. Do you have any questions? Yes, thank you very much for your presentation. Congratulations. And I would like to congratulate the agency for organizing all this. We work in a national company. We work in every autonomic region. Some sites deal with 5 different regions. So this thing that you have explained raises a few challenges. For example, having different systems to enter the data could be an obstacle when it comes to achieve the goals we need to achieve. So my question is, since we're seeing that with regards to inspections, there are different criteria applied in different regions, is there any initiative in the Ministry of unifying standards and working and having everybody working in the same direction? Well, with regards to the different communication, depending on the geography, we understand that it's difficult. However, Royal Decree established that the responsibility of this data collection lies in the regional, in the autonomous region. So it has to be the region itself, the one who has to establish what needs to be done. I don't know whether you're in an electronic platform. I'm not going to recommend any one of them, but there are several working both with us and with autonomic region system. In these platforms, once you record the prescription, the platform is going to send the information to the regional system or to Spruijt. So, in a way, if you're already in that platform, this obstacle is overcome. I would like to say that Spruijt is not an e-prescription system. It gathers data from e-prescriptions, part of the data. So they are 2 different systems that we should not mix together. You have e-prescription systems, which are most of them are private, and then our data collection. So they can depend on each other because one uploads data in the other one, but they can also be completely independent. With regard to different criteria among different regions, well, that's a different story. In the Ministry of Agriculture, we have a drug control plan and a hygiene plan, and they both control the use of antibiotics. And there's a coordinating group to bring criteria or standards together to make things as consistent as possible.
So this manual is really tries to highlight some of the deficiencies in the different autonomies in different regions of Spain, because it's clear that people have different criteria and there may be differences. So that this is the work in the ministry that we have to do. We work to make these homogeneous so that the interpretation from one region to another will be as similar as possible. Thank you very much. Another question there, because we were just about, we're going to have another big debate at the end of the whole session, so we'll have plenty of opportunity at the end. Okay, this is a very simple question. I'm the technical director of veterinary industry. Which are the autonomies that already have the system to send information to the ministry? Is this situation going to change? Is this because there's been legislation that's gone ahead? Can they build another system individually themselves later on? How is this situation exactly at the moment in this country? Well, right now, if I'm not mistaken, there are 4 autonomous communities that are providing data right now, and we expect that the rest of them, of the 17, will be in for January. So we're working with 4 at the moment. We may have some more. Some have said they're interested in developing their own autonomous system, but what we can say is that once we've developed the platform for data collection, so once we have the system going from one system to another, it would be very different. If we get a call from the Presby web to the system, it would be virtually the same. There would be no impact for those who've developed their own individual systems. So the 2 systems could work together. Sending it from one place to another should not have much impact in computing terms. The fields that have an Excel and fields that don't should not have a lot of differences. The structure will basically be similar in both cases. Thank you. Ines, I think you've earned your coffee. And we put it outside, just along the passageway, along the length of the passageway. So I don't know if they're having a meeting in room B. If they are, we should perhaps move up to the end with our coffee. So if we see that they finished their meeting in room B, then it's okay, then there's no problem. So let's come back at 3:45. Thank you. We'll start our last part. Let's see if everybody can sit down and we'll get on. We have here the last presentation, and then we'll have a round table so that we can discuss everything. The last presentation will be by Sarah Sacristan. She works with us here in the agency on the National Plan on Antimicrobial Resistances in the veterinary section. So she'll be talking about the Reduce plan, Reduce, and she'll be presenting results we have so far on this, from this plan. And we'll be also describing the next steps we'll be taking in the new plan. As the director has already mentioned, we'll be presenting it on the 18th of November, or, sorry, 16th of November, which is a Friday. And the key points that we've included in this new project. So it's to continue with the Reduce plan, which has been a success, as we'll see from the results in this first stage. So Sarah, please go ahead when you're ready. Good afternoon to everybody. I'm not going to thank the organisation for inviting me, because you know that I form part of this team on the plan. But I would like to take the opportunity to thank you all for being here and for being in this first line of the resistance, antimicrobial resistance, because it's one of our key priorities in public health. And sorry, Sarah, I forgot to say, can you talk a bit more slowly for the translation? Thank you very much. I would also like to thank my colleagues. They've chosen me to speak, but all the work that I present will be by a group of people that form part of the plan. So with all this help together, it would not have been possible to organise this session if I'd just been doing it on my own, and to be able to present all these results. So,
visitors, because I'm going to speak in Spanish, but if you want to stop me, I can't solve any doubt you have. Bueno.
Okay, so we'll continue in Spanish. I'm going to present, as Cristina said, the plans we've created to reduce on a voluntary basis the consumption of antibiotics in the animal sector. So before anything else, I want to ask the question, which I think many of you will have resolved yourselves. Why do we have a plan in Spain, and why do we need this plan? It's not just because this is a maximum priority for public health at European level and world level, and also, of course, national level, but because 4 years ago, or almost 5, when we started out, we realised that in Spain there were 4 key reasons that were more important than any other technical reason. And these very worrying figures that we have. At the moment, we have more than 3,000 deaths associated with resistant antibiotics, and also much higher than traffic accidents. So we know that Spain is one of the countries in the European Union that has highest consumption of antibiotics, both in animal health and human health. We also know that the level of knowledge of this problem of resistance and the consumption of antibiotics is pretty deficient across the population. We know this as professionals that are very involved in this problem, but across the board in the population, there's the level of knowledge about this is pretty low. So we know that 1 of every 2 Spaniards believe that antibiotics cure the flu. And when we ask our family members, our relations, etc., they think that antibiotics are present in the meat they eat and other food from animal production. So another of the big problems is that the use of antibiotics, which I think is critical for human health, continues to be necessary in animal health, animal production. Okay, so as I was saying, Spain is one of the countries with highest antibiotic consumption. We can see this here in the graph, but We see this in the blue graph, the level of consumption of antibiotics in both human health and animal health. 35.8 DHDs in human health and 72 in animal health, compared with the 24 in and 124 milligrams in animal health. So, for this reason, and to look at the data of the European Union along with the European plans as regards the fight against resistances, we created this plan in 2014. As we know, the main objectives were 3: to reduce the use of antibiotics in human health and also animal health, and also encourage the prudent use, but also reducing the arsenal of antibiotics in general, in both human and animal health. So we've been talking about this over the last few years now. We all form part of this plan, which is a public plan. It's coordinated by our Spanish Agency of Medicamentos in relation with the two ministries that are most involved in this fight: the Ministry of Health, Consumption and Welfare, and also Agriculture and Fisheries, apart from 6 ministries that are inextricably linked to this in the autonomous communities and different scientific societies and organizations which involve more than 300 experts. So you are represented in this slide here. The first edition of this plan ends now at the end of 2018, and the second edition has been approved by the Technical Coordinating Group, but has to be approved by the autonomous communities, our regions, and that will start on the 1st of January 2019. So before we begin, we should say that the key priorities of the plan cover human and animal health. For animal health, what we're most working on is our Achilles heel, which is the consumption of antibiotics. So to be able to solve this problem and reach prudent use, what we do is, on a day-to-day basis, we improve this surveillance system for consumption, veterinary consumption. So we've been working on this SWAC project, and up to January, as commented by our colleague in the Ministry, this is the only system established in Spain, harmonized to be able to collect data on antibiotic consumption based on the level of sales of antibiotics. This is a project harmonized across the EU with a collaboration of 30 member states, focused I'm just looking at checking the screen, says the speaker, that we're in the right place. So looking at the sales from laboratories who are marketing these products. Also, we get data from wholesalers, retailers, pharmacies, and also farm distributors who distribute antibiotics. So this comes out every year, and on the 15th of October, we get this photograph, this snapshot, which places us in comparison with the other member states. The only problem that this report has is that I've referred to 2 years ago. We need a year to collect the data, another year to validate this data across Europe with the rest of the countries. So on the 15th of October this year, the report came out for the level of sales of antibiotics in 2016. Then we have a very good part, which is the surveillance system, but there are 3 factors we have to look at. First of all, the level of sales of antibiotics. Secondly, that it's 2016, not now, and until January we don't get our system for collecting data on prescriptions, so it's not a true comparison at the moment. So the data we have for the last 3 reports, 2014, 15 and 16. You can see that doesn't put us in a very good position compared with other countries. 2014 was our worst year. This report was published in 2016, and this puts us at the head of consumption, well ahead, above of the 400 milligrams level. So if anybody has any doubt, you can see we measure the consumption in sales in terms of milligrams. So this is the amount of active principle sold or consumed. It may be the total consumption or by antibiotic family, taking the CPU. It's a unit of mass which can be treated this is 1 year we're talking about. So if we have consumed more than 400 milligrams per PCU per animal treated. In 2015, we saw a slight drop, which put us in the second position at European Union level. And this is the last report that came out 15 days ago, where we see where we're quite a bit lower down, but we're still fairly high up in comparison with the other member states. Not just compared with Cyprus or Hungary or Italy, but what most concerns us is that compared with Germany or France, our neighbour, who are the main competitors at production level, there's quite a lot of difference. So we have some good news. We have to see everything from the positive point of view. This is from 2 years ago. We know that our current consumption is quite a bit lower than this, and the trend is downwards. So we've come down 14% in 2 years. So since we started the plan in 2014 to 2016, in those 2 years. Okay, so consumption of specific antibiotics. This is a bit small, the graphics, but I wanted to mention and show here that we've had a drop in the consumption of certain families of antibiotics, which is great success for us and indicates that we're on the right track. For example, the case of tetracyclines, sulfonides, macrolides, and also colistin has come up quite a lot. But we're still worried about certain antibiotics like penicillin, where we haven't managed to get a drop. It's maintained constant. The case of fluoroquinolones, which is the same case, or the case of aminoglycosides, where they've actually they increased in 2016. So the indicators that the EU is looking at to see what the evolution is of the development of these plans is across the countries is category 2 antibiotics, which can only be used as the last recourse, of fluoroquinolones and cephalosporins of 3rd, 4th generation quantitatively have not been used very much, but we haven't managed to bring these figures down. Case of fluoroquinolones, quantitatively they're used significantly, and we haven't managed to get a drop there between 2014 and 2016, always talking. 2018, they are definitely better figures, but we don't have that report yet, of course. In the case of antibiotics considered critical for human medicine, the figures are fairly constant apart from colistin, which has seen a drop which is very significant. In the case of stratification by species, we're looking at this in general in terms of tons. We can say that most of the antibiotics are prescribed for porcine. This is 75% of the tons sold in 2016. That's gone to pigs, 4% for cattle, 12% for poultry, and then for ovine caprine, we have a fairly significant level of antibiotics that we must not ignore. So as regards critical antibiotics, we can see the use of colistin in the porcine area, that's light green, and also the use of macrolides macrolides, and also agricultural use. Fairly high figures there. You should bear this in mind, because this does not reflect the reality now, but this is what we've had published just a couple of weeks ago. So based on these results, what we want to emphasize is how we used all this data when applying our work at field level, going into the sectors and looking at voluntary action. So we started off with porcine sector. Why do we start with pigs? Well, for three main reasons. First of all, because this is the most important sector in production in Spain, and it has a lot of capacity for improvement due to the fact that it's the most productive sector. It has greater resources, more money behind it, and it's a production system which is integrated. So if we reach major companies, we can reach an awful lot of farms, which is not the case in other sectors which are more atomized, more fragmented. This is the case of in Spain. So what we've done is we've looked at the main problem at the level of use of antibiotics in the pig sector, which is a case of colistin. Colistin has 4 elements which makes it very important, which leads us to be particularly concerned. First of all, colistin for years has been used systematically in the treatment of animals for food production and for the treatment of pre-weaned animals, piglets. So at the same time as using this colistin systematically without any problems on a regular basis, in human medicine, this has become a last recourse medicine for treating infections as serious as enterobacterial treatments. Or this antibiotic was used as a last recourse in spite of its nephrotoxicity. There have been cases where it's been preferable to save the life of the patient and maintain the patient with dialysis for the rest of their lives. So it seems one of the most striking cases. At the same time, in 2016, there was an article that came out on the appearance of the MCR1 gene, which is the first gene discovered which had resistance to enterobacteria. This was not just discovered in countries like China, which are but also in Europe, in Holland, France, and the UK, Spain, Portugal. So MCR1 gene, this is. So in 2016, with this background, the European Agency published a note talking about a maximum use of colistin of a certain level which should be followed by the European countries, 5 milligrams per PCU. So these were, Spain was not just at the head of the use of antibiotics in 2014, but in colistin, we were using 37 milligrams per PCU. So we've got to get down to 5, making it possible to even reach 1 PCU. So our neighbours, or not direct neighbours, but our fellow European countries in production, in porcine production of these, Germany is down at 13, but many are much nearer 5. You can see here the figures: France 6, and Netherlands 0.9, so Denmark 0.5. So if you, on 15th of September 2016, we had a meeting with the pig sector, with the farmers and also the companies and vets, and they decided voluntarily to reduce the consumption of colistin in this sector. So they signed an agreement for voluntary reduction in each of the associations for pig production. And they established 2 main objectives. One was to reach the 5 milligrams per PCU for colistin, but also to maintain, alternatively, to avoid neomycin and promycin on an alternative basis. So we have 55 companies, pig-producing companies, which have signed this agreement. These 55 companies for pig production have given us this data. This is at the beginning of 2018. Can you see the results in 2015 as regards the consumption of colistin? This was 51 milligrams per PCU. We are around 37. These 55 companies were not at 37, they were up at 51. So they have managed to reduce at the beginning of 2018 down to 7. And with another drug, they've gone down to 12 from 83, and ibuprofen, they have maintained this at a fairly low level, so we're not particularly worried about this. As regards colistin, there was a reduction of 82%. So this means that these 55 companies represent more than 80% of the pigs slaughtered every year. So this is about 40 million pigs we're talking about slaughtered every year. It's a reduction of 86% in the consumption of colistin, 78% in neomycin, and low maintenance of low level of apomycin. So how have the companies managed to get to this point? There's such a successful reduction. Because really this is fantastic data that in 2 years they've managed to achieve this. Well, the first thing has been thanks to awareness raising, not just done by ourselves, but also all the pig producers associations. So this is in the prudent use of these drugs, improvement in feeding, better weaning management in pigs, better hygiene, better safety and security, better increased immunity for the mothers and also the piglets, and also thanks to the support of the Ministry of Agriculture with their surveillance plan, which is run in parallel, and also this has been possible due to the power that the sector has in terms of resources, awareness raising, etc. Spain is the third producer, porcine producer in the world, so this has been tremendous success for many people. Last year, on the 18th of November, making the most of this meeting the companies that formed part of the plan, 41, were given a recognition for their work, for the progress they've made in the right direction. So through this was the agreement for voluntary reduction of colistin consumption in the porcine sector. So major success in the porcine sector. We've considered that we should transfer this type of program for prudent use of antibiotics over to the other sectors which, as we explained, we saw before, some have quite a high consumption of antibiotics. So there were 4 major benefits here. It would give us data on the consumption at farm level, because the only data we had was on the sale of antibiotics for these sectors. This would also involve the sectors in prudent use of it by disseminating this information, publicizing it. So this is an example for the rest of production sectors, animal food, and also promoting the use of alternative drugs through improving biosecurity, safety, diet, etc. So we were able to reach these farmers thanks to the help we got in involving these individuals and the sport. So then also the broiler sector this is a very integrated sector, so it was easy to involve all the members. As I explained, there were many companies involved in overseeing many farms. So in the case of broilers, the objective was to reduce by 45% the use of all antibiotics. 20 companies were formed part of this plan. This is about 75% of production of broilers in Spain. These are the figures that they've given us. As regards of quinolones, from 2015 up to the first 6 months of 2018, there's been a reduction of almost 79% in the use of quinolones, 70% of the use of amoxicillin, and 93% of colistin. So this means a total of decrease of 71% for all antibiotics, which was above 40 milligrams per PCU in 2015, and now we're down to 12 milligrams. So this is these 20 companies. So that was really quite a huge reduction of 79%. Another sector that is fully involved in reduction plans this is a sector which is much more atomized, and with the rabbit sector. So we have much fewer data there, but our colleagues who are working on this do have figures, huge figures of a reduction of use of antibiotics in the rabbit sector. So there have been we wanted to reduce 30% the use of antibiotics as one of the key aims. Also, marked as an objective was to not use colistin orally or in pre-mix, and also we have established 4 key guidelines for handling rabbits on the farm. Maternity, no medication for mother rabbits, no systematic treatment with antibiotics, and also special treatment for before weaning, the use of limited use of premixes, limited to 2 molecules. The state in also in other phases of priming, general reduction in agriculture in the use of antibiotics. So in bovine sector, we've established a series of objectives. This is what's we've most noticed due to this decisions taken and the radical attitude adopted, which has been very positive. A complete elimination of medicamentous pre-mixes, and also marked as an objective was to eliminate the systematic use of antibiotics via in oral form, through milk, etc. These will only be used in very clearly defined cases, and also in only metaphylactically, and also the use of diagnostic tests and sensitivity tests to try to limit the use of antibiotics to very clearly defined cases. Category 2 only to be used as last recourse. And so the whole sector, bovine sector, is being involved here. The industry, the farmers, the vets, the associations, etc. So in the view of this success, we can say that we have data at the farm level, which are an excellent example for all production sectors, and encourage the use of other alternatives of non-antibiotic treatments. So we have set as our priority for our new plan for 2019 to 21 to work with the bovine, the milk producing sector with turkeys and domestic animals, and also laying chicks, laying hens. So thanks to the idea that came from human health, from La Paz Hospital in Madrid, we have these posters to encourage the prudent use of antibiotics in hospitals. And we got the idea also of taking this to the animal sector. So we've created these posters for vets, which can sort of support the idea and help awareness raising, because this is one of our main knowledge gaps, I think, and one of our shortfalls perhaps. So we've created this a bit more focused to, and one more to agriculture, other to small animals, another to porcine sector, particularly in colistin, then bovine, caprine, and sectors, and a checklist for the vets so that they can have this checklist on next to their Pirelli calendar. They should have their checklist on what should be done as regards prudent use of antibiotics. And also for coniculture, for rabbits. So this is the, so as I said, it's a case of limiting to 2 molecules, particularly in the weaning period for enterophilus.
Toda la información que os he comentado.
All the information I've just given you, and more than that, is in our web page. I invite you to visit it because it's been constantly updated by our colleagues from the communication department. And we're highly involved in social media. I invite you to visit our accounts, to retweet our tweets, and to like our posts, which is very important today. And thank you very much. If you want to ask any questions.
Gracias, Sara, por...
Thank you, Sarah, for your presentation. Please take a seat, because we're going to start the Q&A. We can have questions related to any of the presentations we've had today. I just want to say that we're really happy to present this data. We're looking forward to presenting it to the Danish people, and we've worked a lot to be here. This was just the first stage of this plan. It was not our success, it was a collaboration success. I have to say that we have a very nice industry. They've been really helpful. They've been very supportive. Every professional in every sector involved have worked a lot in order to achieve these reductions. I publicly want to say thank you. I would like to thank them for their support and for their support they will continue to give us under the new plan. Please don't get tired. We have new challenges for you. So now we'll open the floor for questions. We've given you coffee. You thought this was going to be for free, but it's not. We've given you coffee because you're going to ask questions or make comments or congratulate us for a nice job, the good job they've done in Belgium, etc. Good afternoon. First of all, could you please introduce yourselves when you ask questions? Good afternoon. Thank you for the seminar. My name is Cristina Garcia, Professor of Pharmacology in the University of Alicante. I don't work with animal health, but those of us working in human health need to be aware of this. Whenever we speak about animal health, this data you've showed, the graphics of antibiotic consumption in fish is much lower. In that graphics was 0.4%, so it's low, but I'm concerned about it because I come from a place where there are a lot of fish farming facilities. I don't know about the consumption of feed, medicated feed, and how this is related to the antibiotics levels at the sea. There are risks of antibiotics not just in fish from fish farms, but also in fish at the sea. So I see that the working lines are mainly focused in animals on land, or companion animals, farm animals. I would like to know about the effects of antibiotic use in fish farm. Thank you very much. I'm going to answer your question. According to the plan, the use of antibiotics in fish farming has been included in the farm from day one. It's something we're tackling separately for two reasons. First of all, the way they give medication is very complicated. It has to be mass medication. And therefore, they have a second problem as a result of this, which is the environmental impact they have. Under the new plan, there's an environmental part, environmental measures included. They're going to see the data we're gathering from different areas, sea areas, and including the potential impact of this medication, which is used in fish farming, and then from an environmental point of view. But I would like to point out something. Feed, any type of food, has no antibiotics residues. I would like to be very clear on this. They can convey multi-resistant bacteria, and we're focusing on that. The consumption we have in fish farming, it seems very high, but when compared with other consumptions, it's not that high. There are very few molecules approved, and they use them. Of course, they use them, but from a quantitative point of view, it's not a sector with a high impact. From a qualitative point of view, they're not using the molecules, last resort molecules we've mentioned. From a qualitative point of view, small animals have more impact because they use very little, but they use last generation molecules. Whereas fish have very few approved molecules, and none of them is highly dangerous when it comes to public health. So they're included in the plan. We have data from their consumption, and from an environmental point of view, they're included in our plan, in our new plan, with regards to the environment department. So you can eat fish all you want. I advocate for fish farming, and they've been included right from day one, and we're reporting data in SWAG, and both from the qualitative and quantitative point of view are not generating a big problem, and that's why we've focused in the more complicated areas in the first place. Thank you. I wanted to add something. I fully agree with her. When it comes to consumption risk, in Spain we have a national plan for waste research where they analyze the safety of the food we eat, both in terms of forbidden substances or allowed substances over maximum thresholds. I agree with her. You can eat fish and feel comfortable about it because we take samples. Fish farming is included in the under the plan, and we carry out random sampling among all fish farms we have. We know there's been a recent problem in that area. I don't know whether your question is based on that. We're going to authorize an exceptional vaccine that will allow to reduce the consumption of antibiotics. But with vaccines or without vaccines, fish farming is included under the plan. Hello, my name is Sonia. I work in Coffe. It's a veterinary lab. We would like to know from a lab point of view, will be required to submit any information in the future? Because you've always mentioned vets, but we labs need to know what we're going to see. So you've said that you work in a... No, I work in a veterinary lab, but resistances. No, it's a veterinary diagnosis lab. Are you going to be here tomorrow? Well, tomorrow we're going to present the part of the plan that we are developing for the surveillance of clinical pathogens. And there's a proposal for diagnosis, and then using the results of this diagnosis to establish a clinical pathogen resistance profile at national level. So in this sense, you'll be involved, because those of you who want to be involved and who adopt the standard methodology that we've developed, you can take part and provide us with data. It's something we really wish. We wish that you take part to map the resistance to clinical pathogens. Tomorrow you will have more information.
Sí, yo tenía una pregunta para Sara.
My question is for Sarah. It's related to the successful reduction of colistin in pigs, but also in other species. I would have expected an increase in the consumption of aminoglycosides. In general terms, there's an increase in aminoglycosides, but in pigs, apparently it has been stable. Some have reduced, others have increased, but in aggregate there's been a reduction. So colistin has been reduced, and at the same time aminoglycosides have been reduced. However, if the global amount of aminoglycosides has been increased, in which animal species has it increased? I'm guessing as a result of reduction of colistin. Yes, we believe that the increase in the use of aminoglycosides has been due to the mass reduction in insignificant sectors such as poultry and swine, reduction of colistin. But in the report published on 5th October, it was the first report in which we have divided the results based on species. It's the estimation made by drug manufacturers. They say they explain the species for which the drugs have been prescribed, but until we have new data in January, we don't know how many drugs are consumed by each species. So we cannot break these results down by species. In the case of aminoglycosides, we don't know what poultry or swine consumed in past years, but 45 swine companies and 25 poultry companies are really aware of the abuse of antibiotics, so I really doubt that they've increased the use of aminoglycosides. But in the case of broilers, we know. In the case of swine, we've monitored these 3 antibiotics I've mentioned in my presentation. But starting from January, and according to the priorities of the new plan, I forgot to say this, we're going to involve the whole sector, because they're already involved in controlling these 3 antibiotics, but the involvement will be extended to the other drugs. So we'll have general data at that point. But yes, it's alarming. Both fluoroquinolones, penicillin, and aminoglycosides are the 3 families we are targeting. Perhaps Cristina wants to add something. I would like to add something. An increase in a specific group is not of concern. I'm not mentioning aminoglycosides, but in the case of penicillins, it's not worrying. Because we, in the veterinary sector, we need to use antibiotics. We're not forbidding its use. We need to use them, and need to use them properly. An increase in certain groups and reduction in others is not something of concern. On the contrary, it's positive. It's the consequence of a prudent use. So now we're using molecules that were not being used, and now we're updating that. This will be the future. Old drugs, old molecules that had been left aside because new ones were used. And in the future, we will go back to those old molecules. They will be updated. They will be made available in the market based on new perspectives, and the use of certain groups will be increased. But I don't think that's bad news. If at the same time we decrease the use of others, such as fluoroquinolones, colistin, cephalosporins, I don't think it's bad news. In the case of aminoglycosides, we're controlling them. These 55 companies are giving us this information. The companies which are not there, I'm not saying they're doing a bad job. I say we don't know what they're doing, but these ones, at least for neomycin, they've decreased it and are promising. There's been a very, very little increase. So I think they're doing a good job.
Bueno, para Cristina o para Sara.
For Cristina or Sara, are these reduction plans dynamics in cattle with fattening feed? We're not using drugs, barely using drugs. If they're dynamic, can we talk to you? Can we extend them? Can we improve the sector? Because you're saying that next year the action plan will be launched. So that was a question, can we extend this? Can we manage it? Of course, it can be extended, but it's exactly what we want. The bad part of our reduction plans is that they're not mandatory, they're voluntary. But that's the good side of it too, because people who are taking part in these plans, they're there because they want to change things, they want to do things properly. And this is the most encouraging thing. That's why we're having these results. So we're 100% at your disposal. Any meeting you want to have, any change you want to suggest, any goal you want to set as a new goal. We have an example in the rabbit breeding sector. Manuel Marco is here. He can verify this as the president of the Veterinary Association for Rabbit Keeping. We encourage them. They came highly motivated, really eager to put antibiotic use and the problems of the sector at the center of the debate. And the awareness of this sector, which is a very small sector, and it's amazing how aware they are of these things. So our doors will be open to any initiative of yours, any project we want to suggest.
Nada que añadir, Se cierra.
I have nothing to add. We close the door Friday at 3. We open on Monday at 7 a.m. We are early birds.
Por alusiones.
Well, since you've mentioned my name, good afternoon. Thank you for this session and your presentation. My name is Manuel Marco. I'm the president of ABECU, the Spanish Association of Vets specialized in rabbit breeding. We need to raise awareness among this sector in general terms. This is complicated in a sector such as ours, where there's no integration. There are no big companies managing farms. It's an individual task, knocking on door after door. This is hard and complicated. There are many farms, but there are differences between them. In some farms, the reduction plans has had barely no impact, but in others, deaths have multiplied by 2. So it's complicated when you're trying to raise awareness and when you're playing with their money. That's what we're told. But the plan is there and we're having results. I would like to take advantage of this opportunity, as Nacho has said before. I would like to validate epidemiology of a diagnosis tool. Now we focus on antibiotic analysis and the information they give us, and it's all very good. But the first page of my veterinary book, they spoke about this, epidemiology as a diagnosis tool. And I would like to advocate for the use of rapid diagnosis tests in yellow, because rabbits are really fast. They die really fast, and we need to apply emergency treatments very often. The fattening period takes 25 days, and I can't tell the farmer to wait 10 days to take a sample, send it to the lab, and then we'll implement a treatment, which can be the right one or not. We need a range of possibilities to be able to do our job. And this is the situation in rabbit. It's complicated. Other species apparently have simpler to deal with, but we're working with what we have. Thank you. Thank you. We know you're working in it. This sector is having a hard time with this, and vets are the most involved parties here. They're pushing for this reduction plan. So you're invited for beer and food. The other sectors are not invited. No, but it's true. It's not easy for your sector and others, such as sheep and goats. They're highly atomized, and it's complicated. Dairy cattle, it's complicated too, but well, let's do things little by little. You need to exhaust them. You need to call them to a meeting, one after the other, and in the end, they won't want to see our faces anymore, and they'll accept to do things just for us, so that we'd stop bothering them. Any other question? Blanca González. I work in Balcom Pines. Meat company, mainly swine and poultry, with an integration system. The question is for Ines. Perhaps it's too specific about how to report as consumption of specific drug. Right now, you can have cases in which the vet carries around a series of products. They can be clinical packages of a certain drug, and they go around farms, and they dispense drugs fractionally. How do we report these using the existing systems? We found it's complicated because you need to include the name, and if it's a stated name, it goes to the national code, and you say 2, but it's 2 units, not the clinical package as a whole. The possibility to prescribe a fraction was included just for feed, but we've studied this situation because this issue was raised a few months ago. It's not about purchasing the drug, but the prescription itself. That's what we want to know. We included decimals in premix field, but also in other drug formula field. So if you prescribe 4 units in a box with 100 units, you have to state 0.04. You need to do some calculations, but that's it. You're declaring a percentage of the package you're prescribing. I've just used this example, but it's just an example. This person is not using the microphone, so we cannot translate.
Sí. Bueno, mi pregunta.
My question is for Cristina, Sara, and the person from the ministry. You've mentioned sheep and goats, and it's true, it's highly atomized. And in order to do proper marketing, we need classified farms. There are multiple origins, short cycles, specific pathologies, but we have very few licensed products. So that makes it really complicated to combine reduction with extraordinary prescriptions, with a good animal health. There's a lot of work to be done, you know this. But I would like to ask whether within reduction plans, I know in sheep we will request facilities to improve the drugs available to us. What types of measures are you considering? We've had several meetings with sheep and goat industry. And one of the points, so to give you an idea, is a sort of document where we identify the commitments of each party, the vet, the farmer, the cooperative association, and there are also points for the agency. And in that plan, the agency is committed to the following: finding ways and working together with associations and drug industry to find ways to launch different therapy tools focused on prevention. For example, vaccines. We've been told that vaccines have to be licensed in third countries. Perhaps they could be licensed here. What vaccines need to be updated? Different profiles. And with regards to drugs, the sector has explained what tools are pivotal for them. We have a problem with this. When an MLR is established, it's easier because we can make this licensing easier. But if there's no MR, it's easier for goats because it's a minor species. But when it comes to sheep, dairy sheep is a minor species except for wastes. They're both for dairy and meat. This entails another difficulty for companies. So we're going to see what molecules we can provide with an MR in cattle that can be transferred to sheep. And we're going to work mainly in new prevention tools, mainly vaccines. This is the commitment the agency has for herself towards the sector. No questions?
Hola, buenas tardes.
My name is Ana Vidal. I work in the UK, the Veterinary Drug Agency there, and my team works in developing and implementing the control plan for AMCRA in the UK. First of all, I'd like to congratulate you for the results you've presented today. I think it's nice to see the improvement you've made. I would like to extend these congratulations to the sector, the industry, because I know how hard it's been in the UK to manage to reduce the use of antibiotics. So I would like to congratulate you for that. One question, I think this is for Ines, about the new BMP regulation with regard to the prophylaxis use of antibiotics and the restrictions this regulation is going to bring, whether you have a position about that, how this is going to be implemented, what's the ministry position, perhaps Ines, Cristina? Well, regulation is for everyone, but it's mainly for the agency. What I mean is that the implementation of all the requirements, because I've realized that the new regulation has been introduced as a regulation for antibiotics, antimicrobials, but it's for veterinary drugs, all of them. Because the way in which the Commission has communicated that this has been approved, they focused in the reduction of antibiotic use. They don't mention other drugs, other medications, other new things in this new regulation, which are also important. It's a regulation, so mandatory when it comes into effect. What are we doing? Well, regarding the use of antibiotics, as the agency director has said, we're trying to answer, to give an answer to the challenges presented by this regulation, and to study the impact in sectors such as sheep and goat, the use of cascade antibiotics. They're going to be impacted directly, because if they cannot use this antibiotics, it's going to have consequences for them. We have to work with them so that the impact is the lowest possible income once it comes into effect. We are going to provide tools for diagnosis, because there's an obligation of having a diagnosis and antibiograms before using critical antibiotics. We need to provide these tools before the regulation is in effect, and then we're also working in everything related to the Ministry of Agriculture. We have specific coordination group just for that. Regarding the impact of the new legislation, there's a part of the new plan which is focused in this, implementing the new legislation and trying to minimize its impact in the different industries.
Sí, bueno, esto...
Yes. This regulation, as Cristina says, affects both the agency's responsibilities and also Ministry of Agriculture, because it's prescription, so we have to work in a coordinated way. From the Ministry, the first measure we've taken was to organise an intersectoral panel with veterinary schools, the agency, everyone involved, to do a detailed analysis of what this impact could be. So before we take a position or impose any measures, our first job is to analyse with clear names about what species we're talking about, to identify the problem, what the impact could be of this regulation. And once we have the diagnosis, we can start to see how to minimize the impact and what measures we have to take to meet the regulation with the least possible impact. Thanks.
Thank you very much, Lucia. Republic. First of all, thank you very much for inviting me, because it's a really huge amount of information I've learned here from all the presenters. So I would like first thank you, and thank for the open door, not just for your farmers, but also from people from other countries. I have a question to Ines. This is two questions, in fact. First is how to teach the veterinarians that they will properly use this electronic prescription tool in such a short time, because it's a quite challenging question also for us in my country when we introduce anything new. So this is really a challenging question. And second question, what veterinarians in my country asked me, how many time I will spend behind the computer providing such data. So this is the two critical questions, sorry for that, but they came all the time from the practice. Thank you.
Yeah, I quite agree with you that it's going to be one of the most challenging issues is how to teach the vet to use that. Nevertheless, I think that the electronic receipt nowadays has a quite it's commonly used, and there are few veterinarians that are still writing prescriptions in paper. So most of these electronic platforms, which are private, they are going to give us their data. So the vet doesn't need to do it twice. As soon as they allow these electronic platforms to collect this data, they allow the platform to give this data to us, so they have no more work to be done. The only vets that are going to have an extra work are those that are still writing prescriptions in paper. In that case, they have to come back home, and after 8 hours work, or that from an optimistic point of view, they will have to go into the computer and load it in an Excel file. What is really challenging is that those that are still not using these electronic platforms, they are going to have to learn to use an Excel file with 5 rows, code where you have to write down. You have to manage with the system errors. You have to understand the system errors. That's going to be one of the most challenging points. We don't have a plan for these vets. We hope they are going little by little. They are coming into the electronic receipt platforms. So that's going to make life much easier for them, because one of the options is to go into these electronic platforms for receipt, and the other option is that they come back home and they load the data. So it's up to them. But we are here we have a system to help the users. So in case they really don't know how to do it, they can contact our technical IT system. We are here for them, but we hope that they are going to use these electronic platforms to make life of everybody easier.
¿Más preguntas?
More questions? Anybody? More questions? Hello, Lourdes. I'm a microbiologist. I have a question for Sarah. You mentioned briefly the porcine sector, the program for reducing colistin. Have you thought about implementing a project to reduce all antibiotics and establish a percentage for reduction? Could you explain that a little bit more? Well, we haven't really laid the basis of this. We were in Anna Pork a month ago, which was one of the biggest conferences for porcine medicine. We saw this was a bit like a bomb, and we dropped it like a bomb, and it was a lot of acceptance, really. A lot of the vets were already working in this system, and a lot of companies know about this, so they are in favour. We have to have another meeting and to set specific objectives, because if we don't establish them, then they will bear on the basis of their capacity. So they've got to be real objectives. We've got to be, they actually reduce very often much more than the objectives set. But we haven't yet, we can't really give figures yet. So in the new plan, we should say that there are some objectives laid down in terms of quantity, 9 for 2019-21, bearing in mind the commitment of each sector. So we'll be passing all this information on. And I think they're fairly ambitious plans, because we feel very optimistic that we can do this. And because we are sure that we can reach these figures within that time frame. So the objectives that we set down in the plan, we're talking about each of the sectors to set the objectives with them specifically so that they're clear on this. Do you have any more questions, anybody? Hello again. More than a question, it's a request for Ines. Both Cristina and Sarah have heard me talking about this a great deal. Inevitably, all this goes through veterinary prescriptions, And of course, there are inspections on these prescriptions. I would ask, please, that could this work across the board equally in all autonomous communities, not just regions that are more global and less global. It does create a lot of insecurity, and it breaks down, it destroys your whole speech. Some autonomous communities have been talking about nutrition tremendously a lot and have been reducing their consumption, and others that prescribe treatments in 21 days, other communities that have prescriptions still with 3 antibiotics and colistin. So it's very difficult to maintain this same discourse if we've got such a difference between the different autonomous communities. So this is a request, not a question. Okay, I take a note of your request and remind you that in the ministry we work day and night to coordinate the action across the different autonomous communities. So I take a note of your prescription or request to make sure that we homogenize and standardize our information, our request to autonomous communities. Okay, so you're going to be the first one to look at these, aren't you? Okay, any more questions from the audience?
Hola, yo soy Gemma.
Gemma Chacon. I'm from Support, which is a diagnostic laboratory for veterinary. I don't know if I'm going to get the answer tomorrow, but I'm wondering about this, and I'm asked by my customers about when there's an inspection that do you have to do a antibiogram? I don't know if this antibiogram, how often do you have to do these? Which antibiotic would this be? We have panels, antibiogram panels, depending on the species, but we do this following our criteria that through the customers. But they'll say, why? They might say, why have you tested this antibiotic and not this one? So why haven't you tested penicillin, which is top use? So in the new plan, will this be legislated on, or will this be recommendations, or will this be qualitative, or will we use the Kimbauer technique or CMI, or how often do you have to have antibiogram in when using a process? And this is a question because I really don't know what, so if we're going to have an answer on this. I think you're going to have an answer tomorrow. Yes, tomorrow. But in any case, I can say that what we've done is we've worked out an agreement to develop a technique, always starting with the porcine sector, because it's the biggest production area, and it's also simplest because it's an integrated sector. But I think that we'll extrapolate this to all species, and what we've developed is a methodology where we do a CMI analysis. It's quantitative, not qualitative, because we use this data to then make recommendations for treatment per area, per regions, farming regions. So we'll present this tomorrow to have a map so that when you're working, you can go to the area on the map where you're working and see what pathologies, what recommendations are made. This will be on the basis of all the samples sent in to us. So we'll be opening this up to all laboratories. So we have agreed on how the method should be developed and applied. So any laboratory has access. Why this method? Well, because in principle we think this will help us most to reach our objectives, which is to find out what the profile is of resistances of clinical pathogens all across Spain. And it's a method which will enable us to draft a set of reports and recommendations for treatment, bearing in mind the recommendations in the categories of different antibiotics. So what we've got now and what we're going to have in the future, because we'll be including all antibiotics. So what? So I may say to a laboratory, you give me this methodology. This is not difficult to introduce. This panel of antibiotics will be the same for everyone. So this is not a complicated methodology. So the lab says, okay, I want to be there, and you come into the system and you commit to passing on all your results you have from your tests. So tomorrow this will be presented, both the methods and also the pilot project, the pilot map. So as regards time, for the deadline for each of these analyses, we have our coordinating group for autonomous communities, which we're discussing right now. We have to discuss what amount of time will be allowed for validity, to establish validity of a test from an outbreak. And once we've agreed this, we will publish this so that all autonomous communities can have the same criterion. But we've argued this out in a meeting, but autonomous communities are waiting for us to supply the finalized proposal. So this will be in the new plan, will be included.
Hi, thanks a lot. And congratulations for your plan of reduction of cholesterol. It's quite impressive. But still, I keep thinking on how you manage that. And there was a dedicated slide from Sarah, and some lines were about spreading awareness, improving feeding, weaning management, immunity, biosecurity, hygiene, and so on. And I mean, in 2 years, how do you improve all this? For example, if you have like a farm with a bad atmosphere, it's not in 2 years that you can change it all over Spain. So maybe I'm just wrong. So what factors, according to you, really made this possibility of using less cholesterol?
Okay, as I told you, it was a very important thing that we have to take in account, that the swine sector is integrated. So every measure we propose to the sector, it's very easy to make because just 55 companies is more than the 80% of the production. Also, they are very important in the production level because they have I don't know how to explain you. They have a lot of force in Spain because it's a very quantitative production, you know, and they have a very high level to improve because economically they are strong and they can make everything I told you, improve the management, improve the biosecurity, improve the feeding, you know, and also yes, also for us it was incredible to see this enormous reduction in just 3 years, but they could do it, and I think in some case they don't know how much was their potential, you know, to this reduction.
Yeah, thanks for your answer. Maybe a question behind that was what part of the reduction is due to unnecessary past use or due to really changes in the practices? Sorry for the little provocation in that.
I believe that this is the most important point.
There was two key points. The first key point was the awareness of the sector. It was a very good starting point, you know. The attitude, the behavior changed completely when the sector was awareness about the problem. It was the first point. Second point was that the sector suddenly discovered that they use colistin for nothing. Because honestly, once that they withdraw the colistin, the problem was there was not problem about the improve of the diet of the pig or something like that. So there were two key points. The first was, but to me the most important was the awareness of the sector about the problem. And secondly was that the sector discovered that when they use properly the colistin, the problem is exactly the same. So there was no problem. They was using colistin for nothing. And in parallel, we have had a project from the Ministry of Agriculture in relation with the biosecurity of the different farms, and the results, well, more or less show that the biosecurity was improved in all these farmers that are in the voluntary agreement.
Yes, as Cristina said, a lot of work has been done in this issue. Not only we have a surveillance plan, not a surveillance plan, a control plan on colistin prescription. That means that a certain number of prescriptions done on colistin has been checked. So I think that veterinarians are aware of this plan and they have been much more careful when having to do this prescription. But as Cristina already said, a lot of work has been done in biosecurity. We have to be honest, it's not only due to antimicrobial reduction, which is a very important issue, but also there is a lot of fear in the sector for African swine fever. So from both sides, there was a lot, it's a very important sector, and there was a lot of money involved in what might happen if the disease comes into Spain. So this has helped us to improve a lot the biosecurity in this sector. There has been, all the holdings in Spain have been checked, and they have a score about this, checking all these biosecurity points. So with all this pressure, not only due to antimicrobial resistance, which is an issue that would have been enough to do all this work, but also we have the African swine fever. A lot of work has been done in biosecurity, so I think this might have helped. The two facts have helped in this reduction.
Another important factor, as Ines said, that is that we focus our effort in the companies that were in the good way, in the plant and doing the prudent use of antibiotics, but also we focus in other companies that they didn't want to adhere to the plan with the surveillance system of the use of colistin. So in all Spain, all the people know or knew how many companies are and were in the agreement, and the companies that weren't or that aren't.
¿Alguna última pregunta?
A last question? I was going to wait till tomorrow, but in the end, I decided to ask today. Just to clarify this, as regards what you're preparing, do you see a difference in the surveillance program, the epidemiological program for bacteria that are causing animal diseases, where you've got by species, by different categories, and what about these antibiograms that are going to be obligatory for use of medicaments? If you make antibiograms with the objective of answering a customer for when we're talking about clinical treatment, if they take part in this program, will they have to give this information? But if you're putting in an antibiogram, or you don't want to, a company doesn't want to take part in the severe surveillance program, there could be a plate, just a plate result. So are you doing it by species? I imagine you are doing this by species, but perhaps you can, if not, if you can't answer it just now, perhaps you can answer it tomorrow. I would say, if there comes to question session tomorrow and there are no questions because everything has been answered today, that wouldn't be good. But yes, of course, this is all differentiated. For each laboratory, we'll be looking at the efficacy of the medication and the results they have before they put this medicament into the market. So with this system, we want to have a homogeneous system so that we can compare data effectively on treatments and use them more effectively. And the second one was, for example, in the British Agency for Public Health, they do lots of antibiograms, but only part of these are inside the official program against resistances. So they have a methodology A for some, and the ones that enter into the resistances plan for human medicine have an official protocol laid down by the official body. So can you have so many samples with a protocol you define, and then in the samples, if you want to join the surveillance program, the company would have to use the official methodology, but they don't have to put all their samples through. We're thinking of the new legislation. If the new legislation will be specific cases where it'll be obligatory to use a specific molecule with an antibiogram in your hand, as it were. Yes, well, it was a bit fast. I don't know if we got all the question. The translators are going mad. Yes, we are. I think, yes, you might want to repeat the question. Did you get that question okay? Did you get it okay? What I was referring to, tomorrow will be even worse. I was referring to the fact that in a laboratory, you can choose if you want to participate with a series of samples or a series of antibiograms in the surveillance program, and you've got to cover this methodology with your program, as happens in the surveillance program at the moment. But if I've understood you, in the new regulation, there'll be a series of molecules that to be able to use, you have to have an antibiogram, and this will, but this will not have to be subject to this methodology or this official system. So you can use a plate system, instead, and not be obligated to use the other system. What we are trying to organize with the autonomous communities is that they have a validity date of 3, 4, 5 months for the report they do on this methodology. We can't introduce another methodology. Of course, labs don't have to just do this kind of analysis following this methodology, but those who wish to get involved in the project and provide this type of report will have to follow this. And then was something I wanted to say to the translators: if we're going to introduce this by phases, porcine, bovine, but we've got different systems. We've got caprine, we've got goats, we've got different. We're working with different universities and study groups to be able to include them as much as possible. So thank you for the sessions. I think this has been great, and to the fact that everybody was involved. So if there are no more questions, then thank you very much for coming along. We will start at 9:30, because for those who have to register, it'll be 9:15 if you want to register. So you'll break the ice tomorrow, and we'll have the same questions tomorrow, perhaps just to make sure that the people who give the papers don't feel that they're getting no questions. Thank you very much.